Hello, my name is Tom Ogondo. I'm a student at Eastern Kentucky University and I'm pursuing a psychiatric and mental health psych nurse practitioner. I'm here to present to you a topic of choice and interest, which is Alzheimer's disease. How is it related to weight changes that occur along with the disease? I would like to give you a few facts and findings about Alzheimer's disease, just to have an insight of what we are talking about. Alzheimer's disease is an irreversible disorder of the brain. It is the most common form of dementia. In America, at least 5 million people live with Alzheimer's disease, from the data found in CDC website 2013. People aged over the age of 60 years are at the highest risk of Alzheimer's disease. People aged beyond 65 with Alzheimer's disease doubles every 5 years. The number of Alzheimer's disease patients is projected to rise to 14 million by 2050. So here comes the big question. In patients diagnosed with Alzheimer's disease, how is stable weight maintenance compared to progressive weight loss affect Alzheimer's disease progression and treatment outcomes over 3 months to 1 year post-diagnosis? I have done observation. I've worked with a patient in a nursing home before. I've worked in psychiatric unit, and most currently in a geriatric psych unit where I occasionally go there and help these patients. So kind of triggered my interest on this topic. So I asked myself again: does this weight loss propel severity of symptoms in patients with Alzheimer's disease, or does the Alzheimer's disease propel severity in weight loss? So I did review 5 studies to support my question, and 2 of them were systematic reviews of data from well-organized cohort studies. One was a multi-center perspective study of Alzheimer's disease and a meta-analysis of a random controlled trial. So, according to these studies, I came up with this conclusion and findings based on the reviews, and it was based on, the topics were based on, seek to review changes in body mass index before and after Alzheimer's disease onset. And the second topic was, based on study for body mass index weight changes and clinical progression in mild cognitive impairment and Alzheimer's disease. The third study was focused on weight changes in Alzheimer's disease patients with increased aberrant motor behavior. And the final one was on body mass index in midlife and late in life as a risk factor for Alzheimer's disease and dementia. Came up with the conclusion from all these studies, and the study suggests there's a positive relationship between weight changes and Alzheimer's disease severe symptoms. So progressive or severe weight loss is related to progressive to severe symptoms of Alzheimer's disease. Maintaining ideal body weight, or BMI, is good for patients' outcomes with Alzheimer's disease. Caregivers play a key role in ensuring Alzheimer's disease adhere to dietary and nutritional needs. Progressive or rapid weight loss is also fatal to these patients once diagnosed with Alzheimer's disease. One of the other things was that, again, sufficient staffing is really required to effectively manage patients with AD. So all studies suggested more studying is still required. Again, like I said, Alzheimer's is a big topic, and when I was trying to select the topic, I found out that it's a big topic in America, healthcare profession, and the cost is enormous. So that's why this topic is relevant. So where do we which healthcare environment do we apply the studies that the findings, these studies? Most patients will be, of course, in other areas because of just the amount of work that needs to be done and the structure that is required. However, we have few patients at home. Majority of patients will be in hospitals, nursing homes, assisted living, or groups home, or geriatric psychiatric unit. Thank you for listening and have a nice day.